everybody. I'm going to do the midterm exam for you, lab exam for you, just so you have a demonstration of it. This is George. He's my son, my littlest kid. He's 9. And so he's going to be my patient. And I'm just going to go through from top to bottom. I will do a little bit of explaining as I go, just so that if you have questions, hopefully I manage to answer them as I work my way through. I probably won't do it perfectly either. The expectation isn't perfection. The expectation is competence, confidence, knowledge, technique, okay? So that's what we are shooting for. Rather than just saying everything's within normal limits, you do have to describe what findings could have been present. That doesn't mean it's an exhaustive list. It just means that we as a faculty you've demonstrated to us that you know some of what you would be looking for, okay? All right, so we're gonna get started. I'm gonna do it exactly the same way that I really would, which starts with me knocking on the door, washing my hands, jumping over here, and introducing myself. Hi, my name is Heidi. I'm your mom, but today I'm gonna be your nurse. Oh, it was. Can you tell me your name, please?
Sure.
What's your birthday?
May 1st.
May 1st, what year?
2015.
Okay. Can you tell me what season it is outside?
Does it qualify as winter or spring?
It's right on the border. I think you're right. Right? So he's alert. He's oriented to time and place. And where are we today?
Massachusetts.
Where specifically?
UMass.
Yeah. All right. So he's oriented to person, place, and time, and situation. And as I'm looking at him, just when I'm thinking about general survey, he looks healthy. He looks his stated age. I don't see his movement looks symmetrical. He looks well groomed, and like his expression and affect are appropriate to the situation. So we're going to do a head to kind of belly assessment of you today, and I'm going to touch you at certain points. It's going to take about 25 minutes. Do you have any questions? No. Is it okay with you if we do it? Yeah. Okay. So Georgie, do you have any allergies or anything like that? No. Do you have, so including like you aren't allergic to anything that's outside? And you're not. Any medicines? No, not that we know of. Any foods? No. And nothing like latex gloves, or you can play with balloons and stuff like that. You don't have any allergies to stuff like that, right? Okay, good. So that gets me through the general survey and the mental status. HEENT stands for head, eyes, ears, nose, throat. So we're going to start with that. So again, when I inspect, he looks healthy and well groomed. His head shape and size look appropriate, which is normocephalic. Not too small, micro, not too big, macro, and atraumatic. There isn't any evidence of any injuries or anything like that. I'm gonna put on gloves, which are over here, and then I'm just gonna take a quick closer peek at your scalp and at your hair. We wear gloves because the time to find out that somebody has lice or some kind of infestation isn't when you have bare hands on their head. Ready? Can you put your chin down for me just a little bit? So I'm just gonna look all the way through his hair. I don't see any evidence of scalp flaking or infestation of any kind. There are no lesions, there are no bumps, there are no cuts, there's no bruises. The pattern of hair growth is totally normal. It's covering his whole head. I don't see any bare spots. So that's as much as I'm doing for his hair. And then I'm gonna his head, and then I'm gonna palpate his temporal arteries. And they're like between a +1 and a +2, I would say. And then I can palpate his jaw, his temporomandibular jaw joint. Can you open your mouth and shut it as far as you can? Okay, and then close it. There's no clicking, it's smooth. Does it ever hurt to open your mouth wide like that? No. If your mouth is sore, then it might, but not usually. No. And then I'm gonna look at his face, and his face looks symmetrical. He has like a handful of little freckles. You get a couple more every summer, I think. You do. Yep, you do. And but there's no piercings, there's no lesions, there's no scrapes or anything like that. His lips look pink and moist. There doesn't appear like there's any cracking or anything like that. So now we're gonna look at your eyes. And as I'm just looking at his eyes, there isn't any obvious issue or problem with them. His sclera are white. There's no jaundice or yellowing. They aren't bloodshot. There's no pinkness or anything like that. There is no ptosis or drooping in the eyelids. There is no swelling or redness, so edema or erythema. There's no N or ectropion. His eyelashes, top and bottom, are just growing straight up toward me. Georgie, can you pull your eyelids down like that? That's the conjunctiva, and it's pink and moist. And now up on in the other direction. And same, it's pink and moist. Do your eyes tend to water a lot, or do they feel too dry to you? No, all right. And then I'm just gonna palpate, and you can wear gloves for this if you want to. His lacrimal structures, there isn't any swelling or bumps. His lacrimal structures are his tear ducts. And then we're gonna look and have you follow this light, and then I'm gonna shine the light in your eyes like you were before, okay? So start by just looking here, and then don't move your head around, but follow with your eyes as I move this, okay? Good. I'm gonna make it kind of like the shape of cat whiskers. And I'm going all the way out to the sides because I have to see his irises need to get all the way to the corners for this to be meaningful. If they don't get all the way to the corners, then I might miss an abnormal finding. For him, his eyes are gazing both in the same direction straight toward me, so there's no strabismus. And when he was following my pen light, there's no bounce at the corners, and that's called nystagmus. So those things are all intact. Can you shut your eyes for me for a minute? When you open your eyes, there's gonna be a light shining in them, and I'm just watching to see if your pupils shrink down real quick, okay? Ready? Open them. Good. So his pupils are equal in size. They're round. They're reactive to light. They shrunk down straight away. They're about 4 millimeters in diameter, I would say, which is normal. They're reactive to light. And now keep watching, right? And they continue to constrict as I move in, and that's accommodation. When it's funny, because we're right behind a window, I don't even need the pen light to do a corneal light reflex. A corneal light reflex means that whatever light I see shining back on me, or shining back toward me, where that light is reflected on his eyes should be in exactly the same spot on the front surface of his eyes. If there's a discrepancy in where that light shows up, it means that his eyes are different size or shape, and I'd be worried about visual acuity, so how good your vision is, but it was right where it belonged. Okay, and then consensual response to light means I'm gonna put my hand right here, and I'm gonna shine this only on one side, but both sides shrink, and only on one side, but both sides shrink again. So there's a consensual response to light too, in that both pupils respond even when the stimulus was only to one side or the other, okay? Oh, one last thing to mention, there's no clouding over his cornea. So the color of his irises and his pupils is totally clear. There's no like filminess to it as I'm looking at it. So now we're gonna go to your ears, and I'm gonna wanna make sure that your ears are, the tops of your ears, can you sit up a little taller, George, please? Thank you. That the tops of your ears are more or less aligned with the outer canthus, or this pointy part of the eyes. And they are, so that looks good. If they were too high or too low, that could be evidence of a birth defect. I'm gonna touch your ears now. And your skin looks healthy. I don't see any piercings. I don't see any signs of infection or drainage. There's no malformation. Does that hurt, or does that feel okay? Yeah, so all the way from the pinna down to the earlobe is fine. What about when I push right here? This weird little part is called the tragus. Does that hurt? People who have external ear infections, that will hurt a lot. So that's why we do that. And then, yeah, it would have hurt bad when you have an ear infection. It hurts a lot. And then we're gonna look inside your ears with this thing, okay? So we wanna make sure that the light is on, and it was before, and it still is now, good. And then I'll do this side first, so hopefully they can see as I'm doing it. So I'm gonna pull, with a kid it's a little bit different, but with anybody it can be different. And the basic gist is you just wanna move the external part of their ear until the ear canal straightens out, so you have a straight look in. All right, ready, Georgie? And I want to ground the otoscope, which means I'm going to put my fingers on his jaw so I can't go in too far. This is a little hard because I'm really fighting with this cord. I'm kind of too far away. And there's a little bit of wax that makes it kind of my view a little bit obstructed. Actually a lot of it obstructed, but I can see kind of like I can see most of the tympanic membrane, and it is pearly gray and it's not swollen, but the wax is like right where the cone of light should be, so I can't see that. So, okay, fine. Now we'll try the other side. You ready? This seems like a bit of a headache. Which way to use it? The cord is like, you can tell we never use this one in this room because it has no slack to it at all. I'll switch hands. Ready? Can you sit up a little bit? You're like a little slumpy. And again, I'm gonna ground it. And then look in. And this one's the same. I'm looking, it's a little bit waxy again, I can't totally see. But this time I can see the cone of light and it's down, it points down toward his jaw, so 7 o'clock over here. And it's pearly gray. There's no evidence of any swelling, no redness, no drainage inside of his ears. They look totally healthy and fine. The ear canal looks healthy, and there's no redness or drainage there either. Do your ears hurt or do they feel okay? They feel okay? All right, so now we're gonna do your nose. Look up at me, please. Thank you. And his nose is symmetrical. There's no evidence of any swelling or a history of fracture or anything like that. Are you having any pain in your face at all? No. So I'm gonna palpate. These are the frontal sinuses. This is the maxillary sinuses. There you go. Can you cover one nostril and then breathe in and out? And now do the other one. You're not congested, and I don't see any signs of difficulty breathing. Was that comfortable to you? Yeah? All right, and then I'm gonna use a pen light, and I'm just gonna peek in your nose. Oh, you actually have a good nose for this. So turbinates are these like kind of structures up near the top that look a little bit like ruffly almost. And so you can see in, thank you, you can see in, and they're just like pink and moist. His capillaries are actually really close to the surface, which makes sense because you just got a bloody nose like a couple days ago, and it's because those capillaries are so close. But there's no evidence of like drainage or redness or swelling or anything like that, which we would expect to see if he had allergies or any sort of viral infection. Okay, so that's that. Now I want you to open your mouth. And I already talked about your lips and they were fine. Open your mouth wide, please. Thank you. The inside of his mouth is pink and moist. His tongue is also pink and moist. Can you stick your tongue out for me, please? Good. It's midline. There's no tremor. I won't put this far in your mouth. Ready?
No, is it gonna make me...
No, it won't. I won't put it far in. Don't be so squeamish. Stick your tongue out. All right, say ah. Okay. His tonsils are a perfect +2 and they're really easy to see. And so those are healthy. There's no white patches or anything like that. And now I'm going to use this again. You can just like open your mouth comfortably. And the buccal mucosa is pink and moist, and his gums are pink and moist. He has some evidence of plaque on his teeth because you are such a reluctant toothbrusher, and a couple teeth that are missing but are growing in, and a couple that are capped that probably previously had caries, but I don't see any signs of any decay or anything like that presently, so I think you're okay. Can you go like this for me so I can see your gums? His gums are pink and moist and there's no evidence of retraction. How about on top? But you have to move your fingers or I can't see. Thank you. And then can you open your mouth all the way again? Good. And his hard and soft palate both look intact as well. Tonsils were a 2+. I don't remember if I graded them or not. And stick your tongue out for me one more time. Open it really wide. Say ah. And his uvula rises midline with just maybe a very slight shift to the right, but it's certainly symmetrical enough that I'm not concerned. So now we're going to look at your neck, and we're just going to see if there are any, you put your hands down, sweetie, if there are any lumps or pulsations that there shouldn't be, and your neck is symmetrical, yes. Can you do this for me to see your range of motion? Good. Now can you like make circles? Good. Put your chin all the way down. And now tip it all the way up. Is it hurt when you do any of those things? No? Now turn your face and push against my hand. Like I'm gonna push back. Oh, there. Okay, now this way. Good. So all the muscle strength in his cervical muscles is good and appropriate to his age and activity level. And now we're going to do, we're going to do your lymph nodes. Okay, you ready? There are a whole bunch of them. Your lymph nodes are like little little pockets all the way inside your body that if there are germs in your body, that's where they get collected, so your body can get rid of it. All right, pre-auricular is in front of your ears. Post-auricular is behind your ears. Tonsillar or jugular-digastric is like just behind this corner of the jaw. Submandibular is under the jaw. Submental is right under the chin. Superficial cervical is superficial and deep cervical are all right around the sternocleidomastoid muscle. It's just a matter of how close to the skin versus how deep they are. So that's those. There we go. Posterior cervical is right behind the SCM. Occipital is right under the base of the skull. Turn your face this way. Occipital is right under here. There you go. And then supraclavicular is right in the hollows of, does it feel gross? Is in the hollows of their collarbones. Within normal limits is I can't feel a thing. None of them are palpable. If they were palpable, you would state the location. You would state if they were hard versus soft, movable versus unmovable. That would be an important finding to make note of. All right, look up or sit up just a little bit, and I'm just gonna look at your trachea. That's the tube that goes to your lungs. It's not visible. It's gonna feel weird. I know, gross, right? But it is palpable. And I don't see any evidence that it's deviated at all. So his trachea is midline and it is movable. And then I'm gonna sit behind you. Can you turn your legs so they're that way, please? Yeah, that's okay. You can put them in bed, no biggie. Okay. And then usually I would have to have him drink water. I don't have any here, so I'm just gonna pretend I'm gonna have you take a big swallow. Sit up a little taller. There you go. And then my hands are gonna kind of go low on his throat, only really one side at a time. So, and then Georgie, can you turn your head just a little bit toward this side, toward that mirror thing, and now take a big swallow if you can. There you go. Now turn the other way, take another big swallow. Good. I shouldn't feel anything, and I don't. If I did feel anything, it would mean his thyroid is enlarged. You can put your feet down again. And I would want to know if there were any nodules or bumps on his thyroid as I was feeling for that, okay? So now we're gonna do your heart and blood vessels, and I'm gonna look at your body first and the way you're sitting, and his neck. Again, there weren't any pulsations or anything like that. I would look with tangential lighting just to see if I saw any shadow that didn't belong there. And usually when you guys are doing this, you'll have the person will be on the exam table, which is already at about a 45-degree angle, but in here, I'm just gonna do it while he's sitting up. The flatter somebody is, the more, the less you should see this. If you still see distension as they sit up higher, that's more concerning. So you would wanna tell us, well, what was the angle that they were sitting at? But in this case, for this exam, you'll just have them lean against the exam table and then look from the side and let us know if you see any if there are any visible pulsations, okay? So that's that part. And now I'm gonna feel your pulses like I did before. Carotid pulses are up here, and I'm just gonna feel for them one at a time. And they are a +3, they're pretty strong. I'm gonna look up now at your precordium, that's just your chest, and I don't see any heaves or lifts. I don't feel any heaves or lifts. There's no thrills or pulsations, so that's good. Thrills is almost like a little bit of a vibration feeling. And then we are going to, can you sit up straight for me? I'm gonna palpate his apical pulse, which is right over his mitral valve. That's at his 5th intercostal space, mid-clavicular line. So 1, 2, 3, 4, 5, mid-clavicular line. There it is, right where it belongs. And it's the size of one of my finger pads, so about a ½ centimeter or a centimeter, something like that. And again, it was 5th intercostal, or I'm sorry, yeah, 5th intercostal mid-clavicular line. And now, I think now we're finally ready to do the listening, Georgie. You ready? So I'm gonna listen to your heart. Okay, here we go. So you're gonna do this for longer for the purposes of getting this done. I'm gonna listen for a little shorter. There we go. But I'm gonna do all those, the same landmarks. So sternal, I'm gonna go to the right sternal border, 2nd intercostal space. And that's over the aortic. valve. And S2 is louder than S1. And then I go to the second intercostal space, left sternal border, pulmonic valve. And again, S2 is louder than S1. Herb's point is at the third intercostal space, left sternal border. And they're the same. Fourth intercostal space, left sternal border is tricuspid valve. And S1 is louder. Sit up tall one more time. There you go. And then fifth intercostal space, midclavicular line, that's over his mitral valve, that's his apical pulse. And S1 is louder. And the rate is regular and the rhythm is regular. Like the rate is within normal limits. I don't know what it is, but I would have taken his vital signs at the beginning. It's probably about high 60s, I would say. And it's sinus rhythm. It's just very, very even. And then I'm gonna flip to my bell and listen in all those same places. You don't need to say the landmarks a second time because you already told us that. All right, and I'm listening for any whooshing or swishing, which would be indicative of a murmur. All right, good, thank you, dear. And then now we're gonna do your lungs. So first I'm gonna start by just inspecting. Can you put your arms down for me? And he doesn't have any apparent distress. Does it feel hard to breathe? Are you short of breath? No. His position is very slumpy, but it's not tripoding. He's not using any accessory muscles. There's no nasal flaring. His color looks good. There's no cyanosis or pallor or anything like that. His chest is symmetrical. His chest rise is symmetrical as I'm looking at it. I'm going to look at him from the side and just notice this should be 1/2 of this. So anterior, posterior should be 1 and thoracic should be 2. It's a 1-to-2 ratio, okay? What's the next part that I have to do? I lost my spot, Georgie. Oh, there it is. So now we're gonna listen to your lungs and make sure you're back on your diaphragm. Ready? So I'm gonna listen to 4 to 6 spots up here, and it's just really anywhere beneath the clavicles. Can you take some big breaths, please? Good. Up here, I would hear bronchial sounds, and I would be listening for any adventitious sounds. So any coarseness, any wheezes, any rhonchi, anything like that, but he doesn't have any of those things. And then I'm gonna listen along his back. I'm gonna start at the top, which is the apex or apices of the lungs. That's from thoracic vertebrae 1 to thoracic vertebrae 3. Can you still take deep breaths, please? Ooh, good, that's better. And I'm listening left, right, left, right, left, right, all the way down so I can compare one side to the other. And still no, I don't hear any adventitious sounds. As I get to the bases of his lungs, it's between T3 and T10. So I'm gonna stop like just above the costal vertebral angle. Good, and there's good air movement all the way through. I don't hear any adventitious sounds at any point as I'm listening. And then I have to come over here and listen to the right middle lobe. Can you put your arm apart for me, please, dear? So there you go. That is the 4th intercostal space, right sternal border, 5th intercostal space, mid-axillary line, and 6th intercostal space, mid-clavicular line. You basically sit up tall for me for a minute and move your arms. It basically ends up making a triangle right there. And so you're just gonna do one listen on that right side over that middle lobe. Hi. Okay, so that is the listening part. And then you're gonna just palpate at the back. So I guess this is as good a position as any. Scoot that way just a little bit, please. Thank you. So I'm gonna feel on his back and shoulders. Does that hurt?
Did it?
Oh, it was a shock. You're a lightweight. All right. And there is no real pain or tenderness. I didn't feel any crepitus or masses or anything like that. Crepitus means, does it feel or like a little bit bubbly or almost like crunchy under their skin? That can be evidence that there's air underneath their skin, free air under their skin, and that's obviously an abnormal finding. And then we're gonna check for your thoracic expansion. And, I was supposed to do, see, I do this in a different order, and if you do it in a different order, it's mostly okay. Sit up tall, please. Thank you. Thoracic expansion means I'm just gonna take a deep breath in, and see if his rib cage kind of opens symmetrically, and then stick your feet that way. Like put your feet up and just go that way. Thank you. And then sit up tall, actually, so you're not curled around. And I'm gonna put my fingers like this, and I'll take a deep breath. And could you see that? How it like opens up, it just flattens out and does so symmetrically? Good. Okay, now you can put your feet down again. If his thoracic expansion was asymmetrical, you would see that didn't spread out evenly. That's what you're looking for here, okay? Let's see if we're missing anything, George. I don't think so. The thoracic expansion on you is probably about 2 centimeters because you're a kid, but for a grown-up, it should be between 3 and 5. And I think that's it. Thank you so much for helping us. Do you have any questions? Such as, can I put my shirt back on? Yes, you may. All right. Thank you so much. All done.